Since the beginning of the pandemic, we've been encouraging Ohioans who have needed critical medical care to continue to receive it. If someone was having chest pains, we always encouraged that person to go to the emergency room, just as an example. Throughout the pandemic, hospitals have been doing what they can to ensure a safe environment for all patients. Now that Ohio hospitals are opening back up completely for all procedures and surgeries, it is essential that if you need medical care, you should feel safe about that, and you should go and receive that. I came across an op-ed piece that was written this weekend, and I wanted to bring in one of the authors who wrote that. Over the weekend, Dr. Tom Mihaljevic, the president and CEO of the Cleveland Clinic, and the president and CEO of the Mayo Clinic co-authored a piece in the New York Times about this very topic. The piece concluded with this: for patients with medical conditions that require in-person care, please allow us to safely care for you. Do not delay. Lives depend on that decision. Doctor, we're glad to have you with us. Thank you very, very much. Interesting op-ed piece. I just wondered if you could just share with our viewers and our listeners really what your message from that op-ed piece is.
Well, Laura, thank you very, very much for everything that you and your team are doing. And thank you very much for the opportunity to present some of the opinions that my colleague, Gianrico Ferrugia from Mayo Clinic, and I have shared with the broader audience. And the reason why we wrote this op-ed piece is because of our conviction that this topic is of a paramount importance for all Americans. Here in Ohio, we have jointly created a very safe environment and have been able to really mitigate and defend our citizens from the pandemic that has really taken worldwide proportions and that has affected so many lives in an unimaginable way. However, as we became successful in combating pandemic, we have beginning to observe an unintended consequence of asking people to stay at home, to stay socially distanced. And people have developed fear from coming to the hospital, even for the conditions that are potentially life-threatening. We have seen a substantial decrease in the number of patients coming in with diagnosis of cardiovascular disease, heart attacks, and particularly with newly diagnosed cancers. What we know for a fact that those diseases have not gone away. What that means is that people are simply not seeking care out of fear. Hospitals are safe. We have created a safe environment. It's really, really important not to delay care. People need to go back to their physicians, their caregivers, their nurses, and make sure that they allow us to take good care of them.
So, Doctor, we've actually seen statewide then a decrease, and you've seen it at the clinic, a decrease in people seeking, let's say, mammograms or colonoscopies and things like that. Is that true?
Yes, we have seen this, and just to remind everyone who's watching or listening, our best chance to combat life-threatening disease like cancer is an early diagnosis, meaning mammograms, screening colonoscopies are absolutely essential for us to be able to detect disease when it's in its early stages and when we can actually cure a patient. We have seen very many patients who are coming with a delayed diagnosis or late diagnosis or cancer or other conditions that we can simply then not help them to the extent that we would otherwise. So it is really, really important that those regular screening, colonoscopies, mammographies, as you have just mentioned, resume. And I can assure you that patients are coming to a safe environment.
So, Doctor, do you think it is just a fear of the hospital itself, or fear of going out, fear that they're going to get the virus at the hospital? I mean, what do you think it is?
Well, that's what we think it is. And actually, we have asked our question, that same question to thousands of patients here at Cleveland Clinic. And what we've learned during this questionnaire, that more than 60% of them are fearful of coming to the hospital because they are concerned that they might become infected while coming to the hospital. I can assure you that is not the case. Hospitals are one of the safest environments to be in. We here at the Cleveland Clinic have 60,000 employees, caregivers, the way we call them, and fewer than 1% of them have contracted an infection, and none of them in the workplace. Our environments are very safe. We screen every patient and every entrance to the hospital for fever. We all wear masks, and we ask all of our patients to wear a mask. Hospitals are immensely clean environments, and through all of those additional efforts, we have really been able to create the safest possible environment to receive care.
So final message then, doctor, is everybody get back in the game, go see your doctor, get your checkup, whatever you need to have done.
Absolutely, absolutely. We're here to take care of you. Please come back, resume your regular checkups, contact your providers. Do not miss an opportunity to stay healthy.
Good. Doctor, thank you very much. We appreciate you joining with us.
Thank you very much. Thank you for having me.
Thank you.